Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe drug Lactulose. Overview and indications. It has been effectively used for reducing the urea production in the colon, thus resulting in lower blood ammonia level for patients with portal systemic encephalopathy. The drug has been used for constipation and will cause increased frequency, weight, volume, and water content of stool. Dosage. Oral formulation in constipation 15 to 30 ml up to 60 ml 10 to 20 grams as a single dose. Portal encephalopathy 30 to 45 ml given 3 to 4 times a day, or a retention anemia of 300 ml mixed with 700 ml of water or normal saline 0.9% every 4 to 6 hours. Pediatric dosing in constipation infant dose will be 2 to 2.5 to 10 ml per day in divided doses. Older children 10 to 40 ml per day or 0.2 to 0.4 gram per kg per dose given 3 to 4 times a day. Administration may mix with milk, juice or water for oral administration. Strength available in syrup 120 ml. Pregnancy status B. May be acceptable. Either animal studies show no risk but human studies not available, or animal studies show minor risk and human studies done and shown no risk. Adverse effects are diarrhea, abdominal distension, flatulence, abdominal cramping, epigastric pain, anorexia, hypernatremia, and lactic acidosis. Thank you for watching Daily Drug Info.